Bertie Middle School is so grateful and elated to have ECU Telehealth services here to service our students. It's important for us to have these services because students sometimes need an opportunity to be able to process some of the things that are going on in their lives. We know that we control pretty much the 8 hours they're here with us, but there are things that happen outside of the building, and kids just need the opportunity and the strategies and skills in order to unpack the things that are going on. So ECU Telehealth, they provide the opportunity for our students to get to speak with a licensed therapist on a weekly basis, and they get an opportunity to learn strategies and skills for them to be successful in the classroom and at home. I will tell you that our teachers have talked phenomenally about the fact that students are coming back with better behaviors and they're using the strategies. Parents have said they're seeing their children more focused at home, and so we are glad that we are able to partner with ECU Telehealth. The other part is that it's a convenience for us to have it right here at school. And so parents don't have to take off work. Students can come in, have a private session here with their iPad, and just have a conversation with someone that's not normally a familiar face in the building, but that's familiar to them because they're seeing them consistently on a weekly basis.
My name is Erika Taylor. I'm a licensed marriage and family therapist, and I'm a behavioral telehealth provider at Bertie Middle School. I work at East Carolina University in the Department of Family Medicine at Bertie School of Medicine. When a student is referred for teletherapy services, they are then scheduled for a couple of teletherapy visits. We generally schedule 5 to 6 visits at the very beginning so that everyone is well aware of when their visits will take place. The day of their visit, they will be escorted from their classroom by a member of the school support team who essentially will serve as their telepresenter. This means that that individual will be tasked with grabbing them from their classroom and escorting them to the teletherapy room that is housed here on Bertie Middle School campus. From there, at the time of their visit, they will be connected through an iPad that's kept here, again, on campus. This is a safe, secure, HIPAA-compliant, and confidential connection. They will then be connected with their teletherapy provider. That is either myself or one of our clinical interns that serves Bertie Middle School students alongside of me serving as their clinical supervisor. Once the visit begins and the student is connected with their teletherapist, the school support team member or telepresenter will then leave the room to allow the student to engage in their teletherapy visit one-on-one with their clinician. We often get questions about what does this service look like practically. We provide anywhere from 6 to 12 sessions, so we do provide what we refer to as brief and short-term care. There are a few reasons for this, but we know that on average, students really can get the support that they need and start to make some positive changes within that 6 to 8 session mark. If a student, throughout our time together, we find the student might benefit from more longer term or more extensive or specialty care services, then we work alongside of you, the family, the student, and the school to find the most appropriate level of care and a level of care that's also going to be accessible to you. We work together to create a seamless transition process between our services and services at either a new clinic or with a different provider. So we're there to support you throughout the way. During a teletherapy visit, there are a lot of different things that we might cover or things that we might integrate into our time together. It's really dependent upon the student as well as the family and what they're looking to receive in the context of teletherapy as a service. When we are together for a visit or a session, as you might hear it referenced, we also are very much looking to the student and or the client in this case to lead and facilitate the direction of the visit. Oftentimes this might look like playing a fun interactive game. We have things like feelings Jenga, Mad Dragon card games, little fun beach balls that have different get-to-know-you questions on them. And we might integrate some of those interactive games and tools into our actual visit. You might also see us doing a dance party or deep breathing exercises to really get ourselves centered and feeling more comfortable to engage in the visit. I've done cheerleading in visits for students that really value cheerleading and participating in that. We've done basketball themed things. So we really try to look at what are the innate strengths of the student, what are their interests, what are things that excite them that they are passionate about or that they were once passionate about. When we're dealing with things like big adjustments to big life changes, depression, anxiety, sometimes those factors can get in the way of us actually engaging in things that we find pleasure and interest in. So we try to explore, what does this student really value? What's something that brings meaning to them and their world? And we try to integrate that into our time together. We also are very much in communications with carers and family members. We value the input of the family system. We know that the student and the family are the experts of their own lives. And so for us, we really want to partner in that together and learn more from the individuals that we're serving throughout the time that we have together. So that's a little bit of our framework. That's how we really approach care and these services as one big unified partnership and really working to build change together. Our team here at Healthier Lives at School and Beyond, which is what you will hear referenced when you hear about our program, we've been so grateful to work in several rural school districts across the eastern region for over 8 years now. And resoundingly, we often get input or feedback of, well, I'm nervous to allow my student to participate, or I'm a little apprehensive because I'm not sure what this will mean or what this will look like. Will I receive feedback that feels uncomfortable? And those bits of feedback make complete sense. And so again, we are really here to work with families to help them feel safe and supported and to really understand our services and also to acknowledge their own level of agency and autonomy in making a decision to allow their student the opportunity to participate. So we are always happy to chat with families while they're in that decision-making process, to introduce ourselves and just simply make it, again, a shared entry into this team-based care approach together. So we definitely invite those that may have reservations, maybe who have never engaged with mental health, emotional health services before, to ask questions, to chat with us. We are always available. We know that this can be a really heavy and big decision, and we honor and respect that and are happy to join you in that process.